What initially brought me to advanced bone and joint was I was getting a lot of pain again in my left knee, and I was procrastinating, and the pain was getting worse and worse. And really what the straw that broke the camel's back is the St. Louis Auto Show was coming up, and my family was planning on going, and we had tickets. And throughout the week prior to the auto show coming, I was to the point where I was hobbling and not putting any weight on my left leg at all. So what my husband and I decided to do was actually rent a wheelchair. We rented a wheelchair and dragged it downtown, and they rolled me around the auto show, and it actually worked out great. But that really was the final straw where, okay, I'm going to call and get an appointment with Dr. McCallister and have him look at my knee. And I know Dr. McCallister because this will be my third visit with him because I've had knee trouble in the past. So he was the only person I wanted to go to. And I set it up and I had my appointment with him. And he decided the first thing he wanted to do is physical therapy and do 6 weeks of physical therapy, see how I was doing at that point, and if I needed to, at that point, if he didn't see any progression, he was going to do an MRI and then come up with, you know, kind of a game plan from that point. But he wanted to try the physical therapy first. And I'm like, okay, I'm all about that. I don't really want surgery. So I did the physical therapy, came back from my follow-up appointment, and things were going really well. I mean, I just breezed through my physical therapy. I did everything that they had told me to do, and I wasn't in pain anymore. And Dr. McCallister's like, that's great. He said, you know what would really help your knee even more actually is if you would lose some weight. He told me about weight loss, and then he mentioned Ideal Protein and said, well, we've got somebody that's been working with a lot of our patients and they've had some great success. And if you'd like, I could introduce you to Delia, and you could ask her any questions that you might have about the program. And he handed me a flyer, and I was looking through it, and he said, well, Delia's actually here today. Let me see if she can come in and talk. So he left. Delia came in, and she sat with me for, it's got to have been over a half an hour. She talked to me. She told me all about the plan and how it was a contract and all the steps, you know, kind of the life cycle of the program. And I really liked everything that I heard because it seemed like somebody was going to be with me all along the way instead of, you know, here's what you're going to do, go. And just be left to, you know, do things on my own. So she answered any questions I could think of that day. I couldn't think of a whole lot, but she said, here's my cell number, text me, call me if you have any more questions. I'd love to help. And that was kind of that. And I went home and I looked through the pamphlet, and that all happened in January. And I didn't finally make a decision to meet with Delia until March. So 2 months of thinking, and I'm like, okay, I'm going to do this.